That sudden cough, that rising fever. Ugh. For any parent, your heart just drops, right? It's a feeling we all know. But what if we could turn that worry into confidence? That's what this is all about, giving you the tools and the knowledge to take confident, effective action. So this is the big question, isn't it? When is that cough and fever just a normal cold, and when is it something more? We're going to break down exactly what to look for so you can stop guessing and feel prepared. Here's our game plan. We're going to start with how to spot the key signs. Then we'll cover at-home care and the best foods for recovery. We'll answer some common questions, talk about the really serious signs that mean go to the hospital, and wrap up with how to prevent this in the first place. Sound good? All right, let's dive into section 1. This is probably the most important thing you can learn to do at home, recognizing those first key signs. Okay, so get this. The single most reliable early sign of pneumonia isn't a crazy cough. It's how fast your child is breathing. In fact, it often shows up before a doctor can even hear anything with a stethoscope. So how in the world do you check for it? Here are the numbers. It's actually pretty straightforward. The key is to do this when your child is calm, or even better, when they're asleep. You just watch their chest rise and fall and count the number of breaths for 1 full minute. If the number you get is higher than the number you see here for their age, that's what doctors call rapid breathing, and that's your cue to call your doctor. Now, rapid breathing usually doesn't show up alone. It brings friends. You'll probably also see a cough that just won't quit, maybe with some phlegm, a fever, and a runny nose. And you'll just know something's off. They're not eating well, they're fussy, or just totally wiped out. When you see these things together, that's when the alarm bells should start ringing. Okay, so let's say you've seen the doctor and they've said it's a mild case you can handle at home. So, what now? That brings us to our next section, how to provide the best care right in your own home. Now, before we go any farther, this is so important. Everything we're about to talk about is meant to support what your doctor has told you to do. It doesn't replace their advice or their prescriptions. The doctor's plan always comes first. Let's tackle that fever. If it's on the lower side, so under 38.5 Celsius, you can do simple things like dressing them in light, breathable clothes, and wiping them down with a warm washcloth. But if that temperature starts to climb higher, that's when you'll want to use a fever reducer, but only at the dose your doctor recommends. It's all based on weight, so it's really important to get that right. And what about all that gunk in their chest? Getting that phlegm out is a game changer for their comfort. For little kids, you can cup your hand, kind of like you're holding water, and gently pat their back to help loosen things up. For older kids, you can actually coach them to do a big, deep belly cough, which works way better than a weak little throat-clearing cough. And here's a super simple but really effective trick. Saline spray. You know, just a gentle saltwater spray. Keeping their nose clear helps them breathe, which helps them eat, which helps them sleep. You see how it all connects? It's a small thing that makes a huge difference. Okay, we've covered comfort. Now, let's talk about fuel. To fight off an infection like pneumonia, their little bodies need the right kind of fuel. Nutrition is absolutely key to helping their immune system do its job. So think soft, warm, and easy. Things like soups, porridges, and smoothies are perfect. You want to pack in good quality protein, some healthy whole grains, and of course, lots of fruits and veggies. On the other side, it's a good idea to steer clear of really greasy, fried, or super salty stuff. And for some kids, dairy can make mucus thicker, so maybe ease up on that for a few days. But if you remember just one thing from this section, let it be this. Hydration is everything. Fevers are dehydrating, and fluids help thin out all that mucus, making it easier to cough up. So just keep offering small sips of water, milk, or juice all day long. Little and often is the way to go. All right, let's move on to some of those other questions that always seem to pop up when you're taking care of a sick kid. There's one in particular that parents ask all the time. This one's a classic, right? We have this fear that a sick child will get a chill. So can you use the AC or a fan? What's the real answer? And the answer is yes, it's totally fine. In fact, a stuffy, hot room is way worse for a sick child. The trick is just to be smart about it. Keep the room at a comfortable temperature, not an icebox. Make sure the air isn't blowing right on them. And, this is a big one, make sure the filters are clean. Good air quality is your friend. Okay, everyone, I want you to really lean in and listen closely now. This is, without a doubt, the most critical part of this entire guide. These are the signs that mean you stop what you're doing and get to a hospital right away. Please burn these into your memory. If you see the skin between their ribs sucking in with every breath, that's called chest indrawing, or their nostrils flaring wide just to breathe, that's an emergency. Any grunting sounds, any bluish color around their lips, or if they're so tired you can barely wake them up, those are all massive red flags. If they refuse to drink anything at all or have a seizure, you go straight to the hospital, no hesitation. And if you're wondering why it's so important to act that fast, look at this number. According to UNICEF, pneumonia takes the lives of about 4,300 children every single day around the world. It's heartbreaking, but the crucial thing to remember is that it is treatable. Recognizing those danger signs and acting on them is what saves lives. Okay, we've been through the tough stuff, but you know what they say, the best fight is the one you never have to have. So let's finish on a positive, powerful note and talk about prevention. Think of this like building a shield for your child. Your number one tool in the toolbox? Vaccinations. Staying up to date is absolutely critical. After that, it's all about the fundamentals we know and love. Washing hands constantly, the amazing immune boost from breastfeeding if you can, keeping your home clean and smoke-free, and of course, building a rock-solid immune system with a great diet. And there you have it. We've covered so much from spotting those first signs to building that shield of prevention. You have the knowledge now, and that's an incredibly powerful thing. So my final question for you is, what's one small step you'll take today to put this into action? Maybe it's double-checking their vaccine record, or maybe it's just making hand washing a little more fun. Whatever it is, taking that first step, that's everything.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.